I guess, ahead of
Yeah.
CU's return and schools going back if they go back?
So we have been working to hire about 4 or 5 epidemiologists to do kind of our lead case investigation positions. And then we will be hiring, I'm going to say this wrong because I don't have it in front of me. I think it's 10 more case investigators and then approximately 10 or 15 contact tracers. The contact tracers will be more on an as-call basis as we surge in and out. Like you said, the schools there's a good chance that you'll see a surge when the kids go back to school, when the university opens back up. So having some people either trained in the county or on an hourly basis that can be called up within a few hours to get on the phones and help do some of that contact tracing. That's the plan as of right now. So we will be hiring out most of that. We have asked some help from the county. It has just become hard to ask for more permanent staffing needs from the county as the county starts to open back up as well.
Hey, Morgan, the only other thing, this is Jeff, that I will add to that is that we developed a MOU and it's been signed now between us and the University of Colorado. So the University of Colorado is going to support us with contact tracers and case investigators. So if there is an outbreak at CU, we would still ultimately be required to do any kind of isolation and quarantine enforcement and support, but they will do the investigations. So that's been a big support from them moving forward.
That's great. Thanks, Jeff. That's good to know.
I will just throw out there that the public health staff and the county staff as well have been, I mean, they have been so, I can't even think of the word, sorry. They have come to us and bent over backwards to try to help as much as they can with the capacity of their own job responsibilities and duties that they owe to the community. So just know that we've appreciated that and we acknowledge that they couldn't give us quite everything, that continue to give it to us as much as some of them were able to back in March and April, but we appreciate everything that they were able to give us. If there are no further questions regarding the budget, we will be back next month with Marielle in hopes to give you a more detailed presentation for both of these budgets.
Thank you, Megan.
All right. Thank you.
Hey, Jeff, Greg's here. So sorry I was late.
Thanks, Greg.
Vacation on the brain, sorry.
That's okay. Thank you for announcing yourself.
You want to continue?
Sure, that's okay. It's up to you all to decide.
I don't have the agenda in front
all right,
of me.
That's all right. I will do it. It's item number 4 now. Is yeah, no problem. Update on the public health implications of HB 19-1230 concerning marijuana hospitality establishments.
Hi, this is Susan Motique. I just wanted to introduce colleagues. You'll be hearing about this new law effective January 1, 2020 that is really opening the door for this marijuana hospitality industry and these business licenses that could be obtained by our cities and towns. So I want to thank the Community Substance Abuse Prevention Team, CSAP, and the Tobacco Education and Prevention Partnership, TEP, for your great work and thoughts on this, always ahead of the curve on these kind of policy prevention issues. And would it be, Audrey, are you going forward with the presentation?
Yes, it'll be me and then Vanessa St. Clair as well.
Awesome. Okay, thank you. Take it away.
Fantastic. Thank you, Susan. So like Susan said, we have a little bit of an update for you all from the Community Substance Abuse Prevention Program and the Tobacco Education Prevention Partnership. So you'll hear from myself, Vanessa St. Clair, and then we also have Gretchen Smith and Allison Bailey here to support with any questions that might come up. So to give you a little background on House Bill 19-1230, which, as Susan mentioned, allows marijuana hospitality establishments. This bill authorizes these establishments where retail marijuana products will be able to be consumed on site if a jurisdiction allows these business licenses to be granted. So what that might look like is the opening up of marijuana bars or a cafe or a some type of lounge paired with a restaurant that does not serve alcohol. And so local jurisdictions have three options when it comes to marijuana hospitality business licenses. They can either opt in to allowing these business licenses, and with that they can either adopt the state level regulations, or they can set their own local provisions that are more stringent than the state level provisions. They can opt out, which would ban these types of business licenses, or they can take no action, which passively bans the business licenses from being available for the time being, but it is not as strong of an action as formally opting out. And Vanessa, did you want to share anything about cities that have already opted out or in from this?
Sure. So we know, and this is, I'll say this is very sort of fluid, and people or local jurisdictions across the state are beginning to have these conversations. But we definitely have one that has opted in and one that has actively opted out. And the opted in is Glendale, and the opt out is Silverthorne. And so there are others, as I mentioned, across the state that are also having conversation, as we're starting to see in Boulder County.
Thanks. So as this new opportunity for marijuana businesses is coming about, there are several related health concerns that the CSAP and TEP programs have identified related to these businesses. And so the first that Vanessa is going to talk about are related to smoke-free protections.
Thanks, Audrey. So this is Vanessa St. Clair. We are very grateful to be collaborating with Audrey and the CSAP team around these licenses, as they have implications for our secondhand smoke work and tobacco prevention. And the bill that Audrey just summarized provides an exemption to the Colorado Clean Indoor Air Act, which allows for smoking or vaping marijuana inside of these establishments. And this presents potential health implications. So there is evidence to indicate that secondhand marijuana smoke contains many of the same cancer-causing chemicals as secondhand tobacco smoke, which was a finding in CDPHE's 2006 review of the literature. And there is evidence to indicate that marijuana smoke contains fine particulate matter, which also has been associated with negative health implications. Indoor marijuana smoke and vapor protections have been in place since 2013 and 2019, when marijuana smoke was added to the Colorado Clean Indoor Air Act and when electronic smoking devices were added. So having these establishments could potentially leave employees unprotected from these secondhand smoke, or from secondhand smoke exposure. And we know from tobacco prevention best practice that smoke-free environments reduce exposure to secondhand smoke, support individuals who want to quit tobacco, and help denormalize smoking behavior, particularly among youth and young adults.
Thank you. Some of the other concerns that that our departments have identified are related to the visibility and normalized use of marijuana, especially among youth. So according to our Healthy Kids Colorado survey in 2017, there's a pretty low perception of risk around regular marijuana use among youth in Boulder County. So meaning if you ask on the survey, ask young people how risky do they believe regular marijuana use is, and a large percentage say low or moderate risk. And we also know that research on both the marijuana and tobacco industries show that viewing advertisements impacts a youth's intention to use substances in the future. Another public health concern is that of marijuana impaired driving. So depending on the type of marijuana product that someone has consumed, it can take between 6 to 8 hours to fully process that product. And therefore, the Colorado Department of Public Health and Environment recommends waiting between 6 to 8 hours between consuming marijuana and operating a vehicle. So that poses some concerns when it comes to people using marijuana outside of their place of residence. And then another area that we are concerned with is that of racial equity. And so we know in Colorado that marijuana business has disproportionately benefited majority white business owners and has caused disproportionate harms to communities of color. And with the agency's focus on health equity, we feel that this is especially important to consider around marijuana hospitality businesses. And Vanessa, did you want to share a little bit about tobacco industry targeting as well?
Yeah, I can just share, that we know that the tobacco industry has targeted communities of color and that tobacco-related disparities exist for these communities. And so much like Audrey mentioned around concerns for marijuana, we know that tobacco industry has had these implications.
So we believe that while there's a lot going on with public health right now with the coronavirus pandemic, we believe this is still a timely issue for a few different reasons. So one of which is the city of Boulder has a new cannabis licensing and advisory board, which is a seven-member city council appointed board. And then the board's makeup in membership and also the concerns based on their conversations thus far are more industry focused. So we want to have a strong public health voice in their decision-making process. In our board communications, we mentioned that they had a meeting on the 6th where they were going to be weighing the pros and cons of marijuana hospitality establishment. And at this meeting, they did not make any decisions except for deciding for the need for more information before making a recommendation to City Council. However, their next steps about how they intend to go about that are a little unclear. Additionally, with the coronavirus pandemic, many jurisdictions are operating on limited budgets, and marijuana hospitality establishments do present an opportunity for additional municipal tax revenue and therefore might be attractive to opt into. And then lastly, we feel like this is timely because the CSAP and TEP programs are being responsive to concerns we've heard among community members. The Community Substance Use Prevention Program convenes the Healthy Futures Coalition, which is a community coalition of youth and adults who are interested in reducing youth substance use in Boulder County. And HFC has developed a position statement from the coalition members about marijuana hospitality establishments. And this statement educates community and decision makers about the benefits of opting out and providing recommendations for responsible business practices for those jurisdictions that do opt in. So kind of addressing both two of the three areas of opportunities that jurisdictions can take around marijuana hospitality establishments. And additionally, CSAP has worked with our youth advisory team, which is a group of 2 to 3 young people who are employed by the county about their concerns with marijuana hospitality establishments, and have incorporated their feedback and their concerns in both the letter from HFC and in the document from BCPH that was included in your Board of Health packet. That's the kind of the 2-pager summarizing the issue. And so I think to wrap us up, Vanessa is going to share a little bit about our proposed strategy for moving forward.
Thank you, Audrey. So because of these implications that Audrey and I have discussed, CSAP and TEP would like our local communities to consider opting out of these licenses. And we hope to provide education to our communities and decision makers about these potential impacts on things like indoor air quality, youth, and health equity. And we also recognize that communities are beginning to have these conversations, and they're weighing the pros and cons of allowing these licenses, as we've seen City of Boulder already begin these conversations through their Cannabis Licensing Advisory Board. So our hope is that public health can have a seat at the table to be part of the conversation and partner with our local communities to provide education and identify solutions that reduce any known or potentially negative public health impacts. And with that, I think we are available to answer any questions that the Board of Health may have.
Hi, this is Morgan. Thanks for that presentation. Are you guys talking at all to like the chamber about anyone who's potentially looking at this? I'm just curious oh, there's my little Sky. If the chamber's been involved in any of these conversations.
Hi, this is Audrey. We have not been actively involved or engaged with the chamber up until this point. And so I don't know their level of involvement in these conversations. I do know Allison, who's on the call, has been active in sitting in on the Cannabis Licensing Advisory Board meetings and might have more information from a City of Boulder standpoint if they've been engaging the chamber.
This is Landry. I have a quick question. Is this just a decision that's made by the City Council, or is this something that goes to the voters?
Hi, this is Audrey again. Anyone from our team can correct me if I'm wrong. I believe it is more than likely going to be up to City Councils to make that decision.
And this is Vanessa. That is my understanding as well.
And this is Jorge. Just a question, that's only gonna happen on, as you know, if it's just in Boulder or in other cities in the county, also the initiatives?
So this can certainly happen in any city in Boulder County or unincorporated Boulder County. We call out City of Boulder right now as an example because they are the only city in Boulder County that is currently engaged in discussions about whether or not they'd like to opt in, opt out, or take no action at this point.
Thanks. Any other questions, board members?
This is Susan. I would just like to thank Vanessa St. Clair. Vanessa, is this your last official act for Boulder County Public Health? No, maybe not quite your
my last day is Wednesday, so I have a few more things.
I just wanted to thank her on behalf of our office for her tremendous service and leadership in the TEP program. She's relocating to Connecticut, but your years of analysis, keen insight, and just support for a tobacco reduction and so many, many progressive initiatives. And I know you've been a leader for our office and influenced, surrounding counties in the state as well. So many thanks and good luck to you.
Thank you so much, Susan. It's been a pleasure working for Boulder County Public Health, and I appreciate the opportunity to serve our community. So thank you.
Vanessa, it's Jeff, and I just want to thank you myself as well. And I also want to thank Allison and Audrey and Gretchen, who I know are also on the call. Just the work that you've been doing in this area has been so much appreciated and so important. So thanks to all of you. Thanks to sharing this with our board and being here tonight to ask questions as well.
You sure you want to leave all those sunny days behind, Vanessa?
I'm not sure, but I will certainly miss Colorado sunny days for sure. But also excited for to be closer to water too.
Well, good luck to you. Thank you very much for all your work.
Yes, and thank you for taking the time to hear from us all and your thoughtful questions as well.
Great. Ways and any more questions? We can move on. Next item is update on current COVID-19 pandemic.
Thanks, Jorge. And I'm going to share my screen here with you. Somebody let me know when you can see it.
Yes, I can see it.
All right, excellent. Thank you. So what I want to do is just cover a few things tonight with you. We have a lot of indicators that we track in quite a bit of detail, but I really want to focus on some key things that are coming up for us. And these key messages I just want to cover quickly. So obviously, every single week, we continue to learn more about this virus. And that is a challenge not only for us, but it's a challenge for the public when we're trying to communicate around what we know about the virus, strategies that we need to take to prevent from spreading it. So I just want to keep saying that because it's important for the public to be aware that we do keep learning new information about this virus, and we do make adjustments and strategies and key messages based on what we know at the latest point. I definitely am going to go through and show you how Colorado is facing a risk of imported cases from some other regions. But overall, Boulder County is definitely in a positive place, and we're building capacity, as you'll see in some of these slides, both nationally, and I'm going to show you some of that data, but also statewide, our cases are starting to increase. And the R0, which is the reproductive capacity of the virus. So you heard the governor in the past talk about the R0. When it's above 1, it means that we're spreading the virus. When it's below 1, it means we're controlling the virus. And if you think back to stay at home, we were around a 3 to a 5. At a 3, what that means is that for every person that becomes positive with the virus, they spread it to 3 people. And then those 3 people spread it to 3 additional people each. So you're spreading to 9 and then to 27. So we want to be ideally below 1. And we are slightly above 1 at this point. It will get recalculated again by the Colorado School of Public Health this week, and we will find out what the R0 is at that point. But it is above 1 at this point. When we looked at it last week with the Colorado School of Public Health, it was slightly above 1. There's definitely evidence that young people are appearing to be the greatest proportion of reported cases. I'm going to go through some of those slides. One of the priorities in Colorado that has been talked about quite a bit, as I'm sure you've heard, is making sure that we're getting kids back to school safely. And there is we've done a lot of work with the Colorado Department of Public Health and Environment representatives. Rachel Herlihy, who's the state epidemiologist, has been involved in these conversations with us, the Metro directors, and an expert that is representing the local chapter of the American Academy of Pediatrics here in Denver has also been participating on looking at how we can produce guidance that's supportive of getting kids back to school safely. There's more and more evidence that it's really important that we do have kids back in school, and there is evidence that kids are less of a transmitter than adults are. So we are watching that closely, obviously, because again, we learn new information about it, but we've spent a lot of time in the last 2 weeks working with superintendents across the Front Range, as well as the state health department and others to really think carefully about guidance in getting kids back to school safely. The other thing that we are running into that will continue to be a challenge for us is testing capacity. So right now, actually as little as 2 weeks ago, we were getting 24-hour turnarounds, 24 to 48-hour turnarounds from the state lab. At this point, we're between 5 and 7 day turnaround time. We are also seeing delays in turnarounds in our private labs, of which I think you all probably know we don't have a lot of influence with. And in those labs, there's as much as up to 10-day turnaround times that we've heard. And that obviously does not work well when we're trying to do investigations of close contacts, when we're waiting on people to get tests back, whether they're positive or not. So we've been leaning a lot on the state. The state is in a meeting today, tomorrow, and on Wednesday to try to figure out how they're going to increase testing capacity. But we know that it's going to be something critical as we move forward. It is not a local issue, and I'll talk about that a little bit more when I get to a data slide. Availability of PPE and is also going to be something that's of concern right now at the state level. There is supply chain issues, as you can imagine, that we're starting to hear about, and it's associated with some of the data you're going to see from the outbreaks nationally. So we've been leaning on the state. We had a meeting this morning with Senator Bennett's office to continue to talk about the importance of that testing capacity I just mentioned, as well as the importance of securing PPE for the state of Colorado as we move forward with what we think may be some more challenges as we get towards the fall. And the last one is masks are critical. It's been a gigantic debate. There is a lot more information coming out that talks about the importance of masks. One of the things that has been pretty important in the last week and a half has been a Goldman Sachs study that shows how much masks contribute to the GDP and the significant economic impact they can have in terms of preventing spread of disease and how that shows up as an economic benefit to the world. So there's more information about that. Happy to send that study to any of you that want to see it directly. But it's also why you're going to continue to see more and more focus on masking as a critical tool in the toolbox as we move forward into these next months. And we've been also, as Megan had demonstrated, funding has been absolutely critical for us. Without the funding that we've received from the state, we would not be able to be hiring the positions that we're working on hiring right now. We know that we can't enforce everywhere and that we can't be everywhere as a public health agency all the time to respond to some of the complaints that we get. So we are bringing positions on that can continue to work with our local code enforcement folks who are already supporting us with boots on the ground and sharing information that they're seeing on a week-to-week basis to help more do education and support for the hotspots that we hear about. We've got a group that's meeting weekly to look at this, that's being run by one of the staff that has been assigned to us from Parks and Open Space, and it's been, now from CPMP, which is under land use. And that person has been critical in helping us really pay attention to making sure that we're following up on areas of hotspots that are complaints. So being able to hire more capacity in those kinds of areas and the areas that Megan discussed around containment and contact tracing is going to be really important. And then finally, individual behaviors are what we know drive outcomes. So the remaining 6 feet distance from each other, making sure that we're wearing masks whenever we're in close proximity to others, and then hand washing. And we can't forget the importance of just hygiene in this whole thing. But masking, social distancing, and hygiene are critical as we move forward. Because again, the more that people follow those things, the better off we're gonna be in how we move forward in the state. So I'm gonna clip through some of these data slides a little faster. What this shows is basically this top graphic up here is for out-of-state visits to Denver County. This one's out-of-state visits to Boulder County, and this one's Los Animas County. And what it basically demonstrates is that these areas that are dark are the areas where people are traveling from to come to Boulder County, to come to Denver. You can see that they're coming from areas where we know there's significant spread occurring. So early on in the virus, it was a challenge with travel, and we need to be keeping a close eye on this and making sure that we're doing everything we can to reinforce the importance of those things I just talked about. We are up to 1,503 cases. This is as of yesterday. And we have 73 deaths. Our deaths have remained pretty stable over the last several weeks. And as you know from before, the majority of those deaths are still coming in our long-term care facilities, which I have another slide to illustrate. This is our Denver Metro County deaths by county. And you can see Boulder is down here in the red. And so we are still low comparative to the rest of the Metro Denver area. And that is consistent in most all of the data that I'm going to show you and that we've been tracking across the Metro region. Okay, where's my, so this is a slide of our daily cases, daily new cases. And the orange bars represent long-term care facilities. So you can see early on in the outbreaks, we were dealing with a lot of long-term care facilities. We worked really hard. We have an entire team internally that's been working with long-term care facilities to really get this under control as much as possible. And you can see in the change in what those cases look like now, that team has been extremely successful, and those long-term care facilities really stepped up to help support this. This is a slide that demonstrates, again, that sort of early age group 20 to 39-year-olds are where most of the cases are increasing. And you can see that in both of these slides, and I'm going to show it in another slide here. So this is the total number of residents who've tested positive for COVID-19 or are probable, and which of those were hospitalized versus not hospitalized down here, and then which were in ICU versus weren't, and then which were deceased from the disease. And as you can see, the majority of the cases that we've had test positive are coming in that 20 to 29 age group. The greatest impacts start at 50, and they significantly escalate as we go into the older age population in terms of deaths. This is the data from this is our residents who've tested positive or considered probable, or who are hospitalized and deceased by race and Hispanic origin. And this data is consistently demonstrating that we have a challenge on our hands that we really need to address. You can clearly see the unequal impact to our Hispanic population here. We are working with the county, and we are looking at priority populations. There is a plan for how we're going to reach our priority populations. We are looking at bringing in a position associated with that, but we know that we have work to do here, and we'll be working with our community and our cultural brokers to continue that work as we move forward. This is the total number of tests per day in Boulder County. Now, when I was talking about testing before, one of the measures is that Boulder County has to be able to have testing capacity to run a total of nearly 495 tests per day. We actually don't have a challenge with that in Boulder County. Our testing ability is pretty good. We almost have that capacity even in one or two facilities. And we have multiple facilities that can run tests across our county. It's not that we can't run the tests, it's that the tests, because of the volume, are slowed in terms of the response. One of the criteria was that we could test all symptomatic people in Boulder County. We've been able to effectively do that, and to reach out to people who are associated with positive cases. So what we would consider a contact investigation, who's asymptomatic, we can also test them as well. So the capacity is not the issue. It's really the turnaround time based on the capacity of the labs that we're sending these tests to. And that's going to continue to be a challenge that we have to solve at a statewide level as we move forward, and at a national level. This is, without going into a lot of background, this is our positivity rate for testing positive in Boulder County. And what we want to do is be below this 5% mark, which I'll have to put a line in here to make it more easily illustratable. But if we're below 5%, then it means that we're effectively testing enough people in the community to find where the positives are, to be able to isolate them and then do contact tracing. So we want to be below 5%. When you look at Florida or Arizona, you're seeing double-digit numbers that are in the 20s. That's where you've not got control of your virus when you're into those kind of numbers. This is the metro area hospitalizations. Boulder County remains low and has throughout this process. This is our total hospitalizations in Boulder County due to COVID-19. So you can see that we've been declining since back at the end of April. Our numbers are continuing to stay low. We do meet with our hospitals on a weekly basis, and we talk with them about this data and make sure that we understand where they are with ICU beds, medical surge availability beds, and how many ventilators are in use, as well as other indicators that we want to make sure we're tracking, like PPE. This is the state hospitalizations. You can see that there's a tailing effect here, but it's starting to go back up. And as I go through some of this regional and then national data, you're going to see that there's a similar pattern that's happening here, and we want to make sure we're holding this tail down to the maximum extent possible. And I'm going to talk at the end about Protect Our Neighbor and why there's so many restrictions on being able to move out of the safer at home phase to that phase. So this is the Metro Regional data for 7-day moving averages of new cases. And this is that tail I was talking about. You can see that there was a decline here around the 1st of June into the middle of June. This was our outbreak up on the hill that occurred here in Boulder. But we're all seeing a tailing upwards. And this is what we need to pay attention to and make sure that we're not letting get out of hand. Some of these tails are pretty large and steep, and we really need to pay attention to those. We do talk about this at the Metro Region, and we are working with the Colorado School of Public Health and CDPHE to talk about what this data means and how it might influence decisions at the statewide as well as local level. This is the statewide data. You can see that same pattern, downward trend in new cases starting to come back up. And then I want to just touch briefly on the national cases. So this is kind of hard to see, but we're at over 60,000 cases per day now in the United States. You can see that at the highest point, we were well below that. We've never really went into a sharp decline, and now we're starting to tail up here, and that is manifesting in what you're seeing here in these graphs. So without going through all of these, Florida, Arizona, and if you look at this, the significance of this graph. So this was from the start of the disease spread. Look at how steep and challenging this is just in the last several weeks. This is why there's such a challenge in Arizona, why people are dying in hospitals, and it's a huge challenge and not someplace we want to be. There's several states like that, and Colorado is over here. It has a small tail on it, and we want to keep that tail small. And again, which is, I think the governor's done a good job with Protect Our Neighbor about making sure that we don't move forward any further until we really have some control here. So this is the last few slides. I just wanted to talk briefly about Protect Our Neighbor. So with the major difference between Safer at Home, which is where we are now, and Protect Our Neighbor is that in Protect Our Neighbor, the gathering size goes up to a total of 500 people, and all sectors are available to go 50% capacity. And in Safer at Home, which is where we are now, there is limitations on caps. The gathering size is not that large. So those are really the major differences between where we are and where Protect Our Neighbor is. And again, I think the governor has been really thoughtful, along with CDPHE. For each of these bullets, these 3 bullets that you see on this page, there's multiple measures, and they're in 9 different categories. And of those 9 different measures that we have to hit, we are meeting 4 of the 9 measures. So we aren't even meeting over half of those measures. In some of those measures, we're partially meeting them. But we won't be looking at moving into Protect Our Neighbors anytime soon. We have to have declining and stabilized cases. As you saw, we're not in a place where we have declining and stabilized cases. And we need to make sure that we have a surge plan in place that's then approved by all these organizations right here that you'll see. And the plan has to talk about how we'll promote compliance with the guidelines, which Boulder County actually is doing really well with, because we meet on a weekly basis with folks who are from code enforcement and others who are keeping an eye on the ground for us. We've been, as you all know, we've been meeting with multiple times with business. We had business business call hours where they could actually call in and talk to us and ask questions. We've hosted multiple webinars with businesses to talk to them about the guidance that it's in place and to help them answer challenging questions. And the Boulder Chamber has really been a huge leader in helping us lead that across the entire county. So I want to thank John and his team for all the work that they've done to help make sure that we kept those things set up and that we were communicating with those businesses often. We also have to talk about how we're going to continue to increase mask wearing. So by extending our order, we've done that, but we will also, again, through the hiring of the education positions, continue to support those hotspots where we hear that we're not getting as good a mask compliance. We do follow up with all those businesses, and we have a team that is working on that, and we're going to bolster that team with some more positions. This will be really critical as we move forward. So we want to make sure we have enough staffing and support in this, moving into what we know will be challenging times in the fall. And then the last thing is, which again I think was extremely smart. We're going into a fall season where we are going to be running into influenza and COVID at the same time, similar symptoms. It's going to be a huge challenge, and we know it. So there is a lot of focus, and there's some funding, as Megan highlighted, that will focus on increasing influenza vaccine uptake. So there's going to be some support from that. We have funding coming into us that we'll be using to promote that. We are talking about this at the metro level. The state is also working on this. So we're really going to be pressing hard on wanting to make sure that we have vaccine uptake. And it's been challenging because with first the stay at home and then the safer at home, we have lost a lot of the vaccinations that we would typically see in multiple areas. And that's been a challenge, and we're really going to have to work hard as we move into the fall to bolster that back up. So this disease has definitely thrown curves at us, and it's going to continue to throw curves at us as we move forward. We are going to have to really focus on making sure that we continue to message how important it is for people to take individual responsibility, not to go into large group settings, to really pay attention to maintaining 6 feet, to wearing masks, and to making sure that we're focusing on hand washing and hygienic practices. So a lot of information. I'm going to take the slide back and see if there's questions that I can answer.
Well, it's pretty comprehensive. Sorry for the feedback. And, you know, I mean, having lived it through this for the last 4 months myself, exactly where you're coming from. Sounds like you guys are right on track. You're doing, and you're being able to leverage some incoming resources. So you guys are doing a great job. So thank you.
Thank you. We have an incredible team that is working really, really hard under really difficult circumstances and situations, and still is able to pull off some of the work that you just heard highlighted before this tonight. So I really owe it to them that we're in such a great place.
I'll just jump in. Also, this is Morgan, just to again commend the team at Boulder County Public Health, because it has been a long haul, a lot of work, and it will only continue, I know, in the months to come. So whatever we can do as board members, but also Jeff, how we can support you and supporting your staff and team, because this is, I can imagine, exhausting for everybody, and with no end in sight. I mean, I think that's the other really hard part, right? Is we are in the long stretch of the marathon here. So if you have thoughts on how we can support you and your team, please, let us know.
Well, thank you. I can tell you that we are doing some debriefs. We're looking at both mental health as well as equity debriefs with our staff. This has been like a tsunami for us. Not only have we had horrible situations with this disease, but it's clearly created racial inequities, as you saw in the data that I just presented, but also with all the other horrible things that are happening in our communities, with George Floyd and many others, and then having the challenges of not being able to get even to our own work. It's been really challenging. I can't emphasize enough how much impact that has had on not just my staff, but staff across all public health agencies. It's been a real challenge, and it's difficult, and we're working forward and doing the best we can. There will be times where we'll come to you probably later in the year because we're having to make choices around not doing some things and doing others, because there's otherwise no way that we would be able to move forward. So if you can just, we'll let you know more about that as we get into the next couple months, but we have had to make some hard choices about where we can put focus and efforts and where we can't.
Jeff, this is Greg. You mentioned that School of Public Health would be updating the R-Not. Are they going to be up? Do you know if there's any plan for them to update that modeling that they do?
There is, and they have, I don't know if you saw, they released it, I think it was last week on Thursday. They released what's called, I don't know the better name for it, but it's called the Shiny app. It allows you to do projections based on social distancing, mask wearing. It has multiple variables that you can adjust in the model, and it predicts what that curve will look like under multiple different scenarios. If you haven't seen that yet, I'm happy to distribute it to the whole board so everybody has a link to it and can actually see how it works. You can play with the model yourself. So it allows you to do some predictions. It can also be drilled down. I'm not sure if it can go to the county level, but it can definitely go to the regional level.
Yeah, if you could send that, that would be much appreciated.
Absolutely, I'm happy to do that.
No more questions from the board? If it's not, we can move to the next item. Director's report.
Well, I'll see if you have questions for me. We've thrown a lot of information at you tonight, and we have a couple full agendas coming up for the next couple months. So I'll just see if you have questions first.
This is Morgan. Just one thing I noticed in the report, Jeff, it looks like you all used some of the, I keep asking questions about capacity just because I know that, you know, again, it's been a really hard stretch for the staff, and we're going to continue to be challenged going into the fall and winter, that some of the folks from food safety acted as contact tracers, particularly bilingual, bicultural, which can be harder staff, I imagine, to recruit. And so thinking about, are there other capacities within public health that are bilingual, bicultural staffers that might be trained in preparation for needing a ramping up around contact tracing going into, just so we're not, you know, scrambling at the last minute to fill positions, but is there an opportunity to train that staff ahead of time to be able to do some of that work if it's needed?
Yeah, absolutely. Let me talk some more about that. And I know there's others on the phone here who may want to add. I see Megan still on, and Susan could add to this as well as others. So we have reached out. We have a list of staff within public health that are outside of just environmental health, that are bilingual. And the biggest challenge and need for us right now is in bilingual staffing. No surprise, one of the most difficult places to do to get positive, to really integrate with the community is in our Latinx community, who's already not trusting of government. And it's really important to be able to reach folks in that community and every community, because we need to be able to find people who are testing positive. We need to be able to support them to make sure that they don't spread the disease further, and that we are able to effectively do contact tracing. And I don't remember the total number, but a fair number of our cases are Latinx folks, and we need to be able to reach that population. So that's our number one need. In terms of case investigators, we've done a request of the entire county. that was sent out. It is being coordinated through Human Resources. Kyla Perlman has sent it out on behalf of them, but we are reaching out to see if we can get some more case investigators and contact tracers. We're also have advertised for and are hiring case investigators. And then the last thing that we're doing is we are working, so the state has been extremely helpful. You already heard me talk about CU, so I won't go back to that. But the state has been extremely helpful because when we were in the outbreak associated with CU, they had just finished training the 50 Colorado School of Public Health students, and we were able to use state staff and CSPH students to help us investigate the cases because we wouldn't have been able to handle that on our own. And just for all board members, I think most of you probably know this, but for every case that's positive, we can estimate between 4 or 5 contacts. So when you're up to 50 cases or 40 cases, and then you think about how many contacts you have to investigate for each of those cases, it becomes a daunting task. So the state has been really good about stepping in and help us. They continued to do that throughout that outbreak. We were able to get a handle on it because of them. And through Sarah Thunberg at the state has also secured AmeriCorps volunteers, hundreds of them at the statewide level. Indira and I spent some time chatting with the person who's running that at the state this weekend. They are coming in to meet with us to talk about them being able to get us some case investigators and contact tracers. I think between the county and the state, we will be able to secure some resources that will allow us to be pretty well positioned to move forward. And we are one of the only jurisdictions that has the agreement with CU, which is significant because that would take a lot more FTE and time. So we can actually use that agreement with the University of Colorado to count towards the number of cases that we need in order to be staffed at a base level here at Boulder County Public Health. The reason that we couldn't do a lot of that before is because we didn't get that state funding authorized until just the middle of June. So we've had to catch up to get some of those advertisements out and be able to hire some of these folks. And then the last thing I'll say is that the contact tracers, I think we will be able to get some contact tracers from the county. And the reason we really want to lean on the county to do that is because when we have outbreaks, that's when we really need those contact tracers. So if somebody works in the county, we have an outbreak, we need them for a couple, 3 weeks to be able to do those investigations, then they can go back to their other jobs. Then that's a win-win situation for us versus bringing people in outside. We have to put them on hourly so that we can flex them in and flex them out. So we really did want to focus on trying to find some resources internally first. And then very last thing, I was going to forget to say it, but it's the first question you brought up, which is environmental health has been a staff that we've leaned on for sure. Joe's on the phone, I think, still, and I appreciate the fact that he's been supportive and willing for that to happen. That means that some of the work that they have normally been doing when we're not in a response like this is having to be put on hold. And it is, we know that we're going to have to make some choices in the organization moving forward about not expecting that people are going to do both jobs, because we are going to need to lean on some of our staff that are currently engaged as we move forward into these next months. And that's where I'm going to be asking the board to make sure that you support us. Where we can't get people in externally, or where we need to focus on people internally because of efficiency and effectiveness, that means we are going to give up some of the work that we would normally be doing. And we'll be having conscious conversations about that once we figure out what does our case investigation hiring look like and our contact tracing requests that we have of the county look like.
Thanks, Jeff. That's helpful to hear. Thank you.
I have a question. This is Landry. I have a question about testing. With the announcements from the federal level that the federal government is not supporting testing and may not be paying for testing, what will be the implication on the state testing level moving forward? We have the state tests now being performed at Salud, but we have also noticed a prolonged turnaround time compared to a couple weeks ago. And I was wondering if that is a result of the lack of federal funding.
I don't know the answer to that for sure. What I hear from the conversations with the state is that because there is a change at the national level, and I don't know all of what's driving exactly where that change is coming from, although I could guess. We are definitely seeing challenges in terms of building statewide capacity. So as an example, when we were having this conversation about statewide testing last week, the state had the ability at that point to run about 3,000 tests per day. The day that we were talking about it, they had received a total of 5,000 tests per day. So they were very clear when looking at the numbers that it was going to be a challenge as we move forward and that they needed to build capacity. And how that gets answered, I think, is the $1 million question, because we know that we can't influence that locally. That is a statewide need that has to be dealt with. We've pressed, again, Bennett's office. We have a meeting with Gardner's office tomorrow, and the state is aware of it and are in this 3-day meeting to try to figure out how they're going to resolve that issue ongoing. The second piece of that that's a huge challenge is that anyone who is using private testing labs, the private testing labs have the ability to choose who they're going to run tests for, how much they're going to charge, all those kinds of things. And the state has had very little influence on that. So if you think about a specific example, like the University of Colorado, we've really wanted to work closely with them to get people tested before they come to Colorado to the maximum extent possible, because we know we can't tax our system anymore. And CDC doesn't recommend testing asymptomatic students before they come in, even though we all would love to do that. We know that it's going to add a capacity challenge to our system at the state. But we only have limited ability to influence those things. That'll be the challenge, is figuring out from the state, how do we actually deal with this capacity issue?
Thank you. I appreciate it. Definitely a source
Hey,
of growing
Jeff,
frustration.
This is Greg. I'm curious, when you talked about the personnel resources and incoming grants, I mean, is there any capacity issues with contracting that's related to the grants or the sub awards that come as a result of those?
So Megan, I think you're still on the phone. I'll defer that question to you if you are.
I'm here. Can you repeat that one more time, Greg?
Sure. I'm just wondering if, with all the incoming funding, if you're having any issues with, just processing what are basically contracts to be able to accept that money. Is it manageable? And do you see that being an issue in the next 3 months?
For the most part, we've been able to get a good hold on it so far. There have been a few things that we've had to go back and forth with the state on, but Spring has stepped in and Melissa Golden have stepped in already and are helping us manage the expenses and any questions that have already come of it. So I think we got ahead of it, and we were asking stuff that the state hadn't produced. So we were kind of pushing them to get it out by their own deadlines. And so far, I don't have any major concerns. I think we just have to stay on top of it, which I've committed to giving at least a monthly update on these finances to our management team. And then as an admin team, we've taken on the role to ensure that we're just analyzing it throughout the period of each different type of funding source that we're seeing.
Okay, good to know. Thank you. Yeah, I know administering, once they're received, administering and tracking and reporting on those can be a bit of a challenge. So yeah, just keep us posted if you see any red flags. Yeah,
absolutely. And I know that Commissioner Jones is on the CARES Act committee, I believe, too. So
he's pretty dedicated and wanting to stay in the loop with us as well to make sure that if we have any concerns, goes back for us.
And this is Greg. I will admit that because I've been on vacation since Thursday, I did not read the director's report. So thank you for that thorough briefing, Jeff.
You bet. Any other questions about the director's report?
Nope. No, for not for me.
As always, let us know if you feel like you need more detail, less detail. This report is really intended to give you somewhat more of a picture of what's happening in the department. You can see that in all those categories, there's still a lot of work that's happening, a lot of great work that has been carried forward by the folks, both who have been involved in this response, as well as those that haven't. So I want you to hear that we are doing bi-weekly all staff calls. And one of the things that I'm doing on those bi-weekly all staff calls is telling staff how much I appreciate the work, not only of those that are responding, but of those who are, going through challenging times to try to keep the work that we do have going forward. And it's not easy.
Yeah, thank you very much, Jeff, and everybody else for all your work.
Thank you.
All right, so let's move to item number 7, old and new business, if any.
So I read the story about the appeals court decision on Friday, Jeff, regarding the northern Weld County not being in the attainment area, and I know Boulder County was the party to that. So great job to all of the people, whether it's attorneys and the air quality program. That was an impressive result. Very nice. On the bad side, we've now had 5 ozone exceedances at the Renewable Energy Laboratory monitor, and we are only allowed 3 that are above the standard. So now we're 2 over, and we still have about 7 weeks to go in ozone season. So it's very likely we'll pick up at least another couple.
Yeah.
So that's a bummer.
Yeah, we knew when we were talking about submitting the letter earlier that this might happen, and unfortunately, the COVID and stay at home bought us some air quality benefits for a while, and we're right back to getting to a place where it's hot, and we've got more people out traveling again.
Yeah. Maybe we should get some masks for the tailpipes.
Yeah.
Anything else?
Nope, I'm good.
Anybody else? All right. Well, it seems like we going to adjourn the meeting.
Thank you, Jorge. Appreciate it.
Thanks.
Yeah,
Thanks everyone for your work.
Of course. Thank you, everyone. Thank you for your work. And we'll talk to you soon.
Thank you.
Yep, thank you.
Thank you. Good night.
Good night, everyone.
Good night. Bye.